Hi, I'm Dr. Rudy Cashman. My passion, frankly, is wellness, and I'm here today to speak about a very interesting subject: preventing, stopping, reversing type 2 diabetes. Very interesting subject, and the odds of doing this is probably 80–90% within a couple of months. Within a couple of months. It's not that difficult. I think we suffer from lack of knowledge. That is not happening. Type 2 diabetes is rampant throughout the world. I mean, in this country, we have at least 40 million people who have type 2 diabetes. And there's type 1, there's type 2, and I explained the difference. And we have 150 million, I think it's probably maybe higher than that, who are pre-diabetic. And the illnesses that a type 2 diabetic gets, which I will discuss in detail, manifest even as type 1. So it's critical that we prevent this illness or reverse it, stop it. The governor was in town yesterday presenting his new HIP-2 program. I thought it was a nice presentation, but he did mention, and I appreciate his honesty in presenting it, that the United States ranks like 45th in the world by the World Health Organization in terms of health, 45th. This state right here is 41st in this country in terms of wellness and health. Shocking, but he admitted it. What's my point? I aim to change that. I aim to change that with your help. I beg you. What am I doing this today? Because I love you, care about you. And it can be done, and not that difficult. So let's go on this road together. What about the types of diabetes? Type 1 is usually found in children, although when the type 2 diabetic keeps on secreting so much insulin to try to push sugar into the cells that the pancreas poops out, and they become a type 1. Type 1 is characterized by lack of insulin. It's found in children called type 1 diabetes. What's it due to? It is due to autoimmune disease, a virus, bacteria attacks the pancreas, but also, although providers really are not aware of it, because I spoke to one the other day, that one can react to the protein in milk, change the immune system. As a result, the virus attacks, and you developed type 1 diabetes. So milk, giving milk to a 1 or 2-year-old, even beyond that, can increase the rate of type 1 diabetes. Yeah, it's also gluten will do it if they're genetically, say, gluten sensitive. So type 1 diabetes, you can, if you don't drink milk, you can reduce the rate. They've studied it in different countries. I can give you the references. It clearly is out of the medical literature. Milk. I'd like you to read a book by Keon, K-E-O-N, Whitewash. Read it. Make up your own mind. Make up your own mind. But I do know the subject, okay? And then, so we have now a great deal of children's obesity. A third of the children are overweight, and a significant number of them are obese, and they're becoming type 2 diabetic now at a very young age. Type 2 diabetes is if you take a cell, and each cell, there are 70 trillion cells, have receptors on them. And if you have elevated triglycerides in your blood, these receptors become sticky, and insulin cannot push the sugar into the cell for energy, because ATP, you got to have it. Otherwise, you would not be alive. But with too much fat in the blood, too much triglycerides in the blood, you develop insulin resistance, and the insulin has got to get the sugar there for energy for you. This here shows insulin resistance. I hardly ever met a diabetic that knows what insulin resistance is, and that's us providers' fault. This is an illustration which I developed, and you see here a cell. You see the ATP, the energy molecule in there. And the I is the insulin, okay, and the starry things are the sugar. You see how many I's you got? And the yellow things is the fat, making those little purple things. You see the receptor sticky, and the insulin cannot open that door. See at the bottom, that's the door. And so much more insulin gets secreted, the pancreas poops out, and now you're type 1 diabetic and type 2 diabetic, and that's what this story is about. So the first step and the development of prediabetes. Diabetes is insulin resistance. A beautiful, I think, a demonstration of it. It's actually a worldwide epidemic. Saudi Arabia, Korea, Vietnam. It's rampant throughout the world, and is related a great deal that we genetically change the wheat we're eating, which is, converted eventually to sugar, amylopectin A. 1949, Dr. Berlow genetically hybridized wheat at the Rockefeller Institute in Mexico, and he managed to feed the world. Wheat, which used to be 12 feet high, now is 18 inches high. The yield, the flour is a lot bigger, so it's a lot more yield, but he never checked it in humans. Never checked it in humans. And that is a reason for a lot of obesity throughout the world, which leads to type diabetes. We call it a wheat belly. And the gluten is different in it. The protein that's in wheat is totally different. Our bodies are reacting to it. And that's why we see this type 1 diabetics in children. They're reacting to the casein in milk and the gluten in breads. So our hospitals are filled with these patients with complications of type 2 diabetes. They're just filled with them. They come in with a heart attack. Invariably, they either have diabetes or is undiagnosed diabetes. So it's a food-created disorder. Food created this disorder. Very interesting. And if you eat the right food, I didn't say diet, did I? Eat the right food, nutrient-dense food, this order will go away very quickly. Actually, very quickly. So what am I saying? Certainly some people need medicine, no doubt about it, but a lot of people need a lot less medicine. So what am I saying? Don't medicate, eradicate. First, you ought to try to eradicate the disease, unless you're type 1 and you need that insulin to save your life, of course. So there's definitely need for medications. The thing I like to do, too, is notify your doctor if you're going to follow the way I'm going to teach you how to eat, because you reverse your diabetes quickly, very quickly. And Franklin House published a book he called it a 30-day miracle. He thought he could do it in 30 days. I've seen that many times. Your provider should tell you that, offer that to you. With the diabetic group, I work with at Lufkin Hospital, where I'm the wellness director. The diabetic group there gets it. We work together, and the first thing that Brenda may say to you, the physician assistant, may say to you, would you like to stop, prevent, reverse this disease? She says it to every patient. I love you, Brenda. I love you, because you're helping a lot of people. And that needs to be done. Your provider needs to say it to you every time. Now, since your sugars will drop quickly because you're eating different food, I mean quickly, you got to know the symptoms of high and low blood sugar. You can print it off my website, cashmanhealth.com. You can print it right off of there. And the resources, I also have 70 previous public access TV shows. They're educating you about fat, salt, sugar, narcotic medications, exercise. That's all on there. It's free, 70 shows. And because remember what I said? We lack information. You need to be educated. But if your sugar drops, hypoglycemia, shakiness, dizziness, sweating, hunger, irritability, anxiety, headache, too high a blood sugar, increased thirst, headaches, difficulty concentrating, blurred vision, frequent urination, fatigue, weight loss. These are all, but you need to know them. I want you to read it off my website. Also in books, you got to know these symptoms, because you don't want to pass out or be driving a car because you're eating differently. Those symptoms of hypoglycemia, incidentally, if you decide to change the way you eat and we get rid of your medications in a couple of months, that situation is over. But you got to eat right and stick with it. So how are we going to diagnose you? So I think this is important. Your body mass index, your BMI, this is a judgment-free zone. We're not going to use any different words here, okay? Judgment-free zone. In fact, all of us had a problem eating one time or another, so this is the way it is. You need to know your body mass index, but know your height and your weight, and you go to tables. You can get them out of my books or other books, or you get a table online and measure. You can also do belly measurements, hip measurements, compare the two. is another way. I mean, a normal body mass index, you know, is about up to 25. Okay, a little different men and women. Okay, a little slightly different. Overweight is 30 and over, 29.9 and over. Obese is between 30 and 35. There I use the word, didn't mean to use it. BMI is elevated. And then if you're 40 or over, that's called morbid problem, okay? You got to act on that. And they found if a person can remove 10% of their weight, odds are you're pre-diabetes and diabetes is gone. 10%. Now, come on. The American Diabetic Association thinks it's 5 to 7%. But let's aim for 10. That's not so bad. Some people lose 5 pounds and their diabetes is gone. So for your provider not to shout this at you and see you back and check your BMI, it's not understandable, is it? It can't be pill to the ill. Get over that. It can't be the pill to the ill. You got to participate in your health care. We love you, please. And we'll tell you about blood tests I want, like you to do. I look at this as a golden opportunity. If you look at Amazon books, I have about 17 books on there, okay? All about health, okay? And just your Cashman, Amazon, bang, they're there. I have one book called The Golden Opportunity. Why is this a golden opportunity? If we've 150 million people walking around with pre-diabetes and they don't even know they have the beginning of diabetes, isn't this a golden opportunity to change the health care in this country? Oh, my God. God, I hope the president or the governor appoints a health czar. Call me. I'll do it. We have an Ebola czar, 6 cases, okay? Yet 150, probably going on 200 million people becoming ill, chronic illnesses from diabetes, and we don't have a czar promoting that, okay? It's not understandable. So it's a golden opportunity. Check the blood even of a child. Heart disease begins at age 2. 2! It was studied in the Begalusa study. Charles Atwood studied 40 years. Every child that died, they autopsied, they get permission. They found fatty streaks at age 2. I'll say it's even before that, because what the mother eats and what they've now found through something called epigenetics upon your genes, so that you can affect your gene structure by your lifestyle, by your environment, toxins, and what you eat. Over 90% of your DNA is affected by those activities. Yeah. You're not just what you're born with in genetic structure. It's the lifestyle. It's things you're exposed to in your nutrition affects your telomeres. That's the extension of your chromosomes, the telomeres, called epigenetics. I can speak about that for an hour. You can find it actually on one of my YouTube things. Listen to that lecture. I think it's very, very important how activities affect our gene structure and your child. Start checking your child at a very young age because then you can correct it. Easy, easy. And you know, the American Diabetic Association says check people about every 5 years before age 40. You want to have this pre-diabetes for 5 years? Give me a break. You want to know right away. Yearly testing. Even in teenagers, you know the blood work. You are what your blood work is. That's more important than BMI even. I want to know what your blood work is. There are thin people who have metabolic syndrome, which I'll speak about, which is pre-diabetic. And so they can be of normal weight, but yet they have fatty liver. This is very prevalent among Asians. So you are what your blood work is, okay? And then get a fasting blood sugar where you don't eat for 8 hours and they check your blood sugar. Over 125, you're diabetic. But it's not as accurate as other tests. For pre-diabetes, I think it's quite important to run the 2-hour glucose tolerance test. You fast for 8 hours, then they check your blood sugar and your serum insulin, fasting 1 hour, 2 hour. That's the test you need to insist with your provider that you have done if your BMI is elevated a bit, because odds are, if it is, you are pre-diabetic. Maybe very early. If you catch it early, remember what I said? 5–10% weight loss, gone. 20 years of suffering, early death possibly, strokes, heart attacks, increased rates of cancer, autoimmune disease, gone. Wow, opportunity to our glucose tolerance test, and get the usual HbA1c, which they get, but where they measure 3 months of your blood sugar combined with protein to make this hemoglobin, HbA1c. That's 3 months worth of sugar. But that's stage 4 diabetes. Stage 4. Stage 5 is amputations, blindness, kidney dialysis. I want to get you early. So we don't hang the hat on the HbA1c. We do order it, but you hang your hat on the glucose tolerance test, on the fasting blood sugar, on the serum insulin, and check the very low density LDL. It's measured in nanoparticles, less than 500. Yeah, that's the one that causes arteriosclerosis, inflammation of your body system. Fat inflames your arteries too, and causes atherosclerosis, arteriosclerosis. And check the lifestyle. That's part of testing. What kind of lifestyle? Do exercise. Exercise is important. Exercise helps prevent insulin resistance, keep the weight down, but just exercise will not do it. You got to eat differently, and I'll teach it to you. Are you an apple shape or pear shape? Okay, pear shape is better than apple shape because you're apple shape, you get a big belly. And that fat in there is a gland. It makes 20 chemicals. Fat doesn't just sit there. If you get a pot belly, a wheat belly, a pot belly, a beer belly, whatever, that fat is white fat. It has a lymphatic system in there. About 30% is full of inflammatory things. And that inflammatory cells that are in there inflame your heart, cause heart disease. Type 2 diabetics, they almost all get vascular disease, heart disease, hypertension. Many have dementia, early Alzheimer's disease, increased rates of cancer. And that's what you want to avoid, okay? And we already spoke about the testing. Another good test is triglyceride. It's the fat in your blood, HDL, the heavenly cholesterol, the good cholesterol that you won't be up. That ratio, it should be less than 3.5. I like 1 or 2, not 3 even. Less than that, the lower, the better. Where your HDL is high, your triglycerides are low, so that ratio is going to be in your favor if you do that. So that's very important. I mentioned a minute about the government's plate that they recommend, but when you look at it, you can look it up on your internet. They recommend dairy for one thing. Remember I spoke about dairy? It's for sugars, for example, and the casein in it has increased rates of cancer, increased rates of allergies. Pediatricians, Dr. Rulo tells me the families he convinced not to drink milk after age 2, they don't show up because they're healthy. Yeah, I checked that way in the literature. So the government recommend dairy. That's because they get the money from the dairy industry. That's why they're doing it. I say water with lemon, lime. Sugary drinks is 50% of obesity, incidentally. So you don't want sugary drinks. And only about 30% of their plate, of the government plate, is vegetables. You have Rudy's plate, my plate I designed, half is vegetables. Dr. Furman's plate, half is, eat all you want. No diet, eat all you want of vegetables, okay? And then they have fruits in there. Fruits are fine, 2 or 3 pieces with a fiber. It has fructose in it. But the darn trouble is fructose is not a good sugar. 2 or 3 pieces of fruit with a fiber and all the berries and strawberries and blackberries and blueberries, fine, because they have a lot of fiber. But you don't want to have more than 35 grams a day, and the reason is that sugar, table sugar, okay, is 50% glucose, okay, and 50% fructose. The same stuff in fruit. I was disappointed in that. Well, glucose goes to the bloodstream, raises your insulin level, goes to the liver, 20% used by the liver, 20% used by the brain, and the rest for energy and glycogen in your muscles, okay? If you eat too much, there'll be liponeogenesis, but that's not easy to happen. So to gain weight from that's not easy. Fructose doesn't raise the insulin level, goes to the liver, makes very low density LDL, fatty liver, which is very dangerous, and that's what goes in the vasculature, causes atherosclerosis, arteriosclerosis throughout your body. Your 300,000 miles of capillaries get inflamed from that. That's why the diabetics will have numbness in their feet and their arms and their legs and go blind, because of this vasculature is inflamed and getting obstructed. So it's the sugar that's doing it, the fructose and sugar. Unfortunately, I spoke to a med student the other day. She was a straight A student, had 1 week to go, and she's going to be a doctor in a week, and she had no idea the chemistry of sucrose. Shameful. I told the dean of the med school, this can't go on. That accounts for 80% of our illnesses. We all got to know the chemistry of sugar. So what am I saying? Early diagnosis, okay? The golden opportunity, okay? Now, stages of diabetes. You'll find this fascinating. You know, I've probably read hundreds of books by different authors, and that's not, I don't agree with everything in every book. I've written 17 books, and everybody agrees with what's in my books. But I seem to learn something out of every book. And here I was Dr. Atkins' book, you know, and they kind of say not too nice things about him, but I tell you, who's the first one to say years ago, he's dead unfortunately now, but years ago, not to eat sugar, as that's a cause of vascular disease, is Dr. Atkins. Meanwhile, the American Heart Association, Ansel Keys, the CDC, the Institute of Heart, Lung, and Blood, the McGovern Commission, all telling us not to eat fat. I mean, there's some bad fats, omega-6 fats. There was a fat theory of cause of vascular disease, and they were all wrong. Eat the Big Fat Surprise by Nina Hayholtz. This thick a book. I've read it 3 times. They knew it too. They were telling us that when sugar was the cause, and the fructose in sugar. I've told it to you. Read Richard Johnson's book. Read Mr. Lustig's book. You can look them up on the internet. Max Hyman, very famous blood sugar solutions. All in there. They're telling you it's the fructose. Sarah Wilson's I Quit Sugar. Wonderful book to read. So you don't have to just accept my word. But let's go through the stage of diabetes. First is insulin resistance. Remember I mentioned that already, where you can't, with the insulin level is up. And you check it in the bloodstream, and your HDL is low. And cholesterol, you know, Steve Sinatra wrote a book, The Myth of Cholesterol. Yeah. You know, they told us for years it was our cholesterol level. No, it's a very low density LDL that counts. I know people with very high cholesterol and they're perfectly healthy. That's not the enemy. It's a very low density LDL. And triglycerides are the enemy. Stage 2, hyperinsulinemia, we're elevated up. Stage 2, your 2-hour glucose tolerance test would have picked that up. The insulin resistance we would have picked up. That's Raven syndrome, which combination of increased abdominal obesity, low HDL, and elevated blood pressure, vascular disease. That makes insulin resistance. Also call it metabolic syndrome. That's a very early stage of pre-diabetes. And number 3 is elevated blood sugar, elevated insulin level. Can be also leptin resistance, where the leptin is made in your fat. And it affects the brain. If the leptin level is high, your appetite goes down. And if it's low, you tend to eat more. So it's a combination of leptin resistance, insulin resistance, also adrenaline resistance, because the nerves that go to your fat, remember I said about lymphatic tissue, nerves go right to it, actually. So now we're stage 3. Stage 4 is type 2 diabetes with an elevated HbA1c. We're diagnosing you with stage 4. Much too late. I must say, I'm screaming this information to providers and hospitals, and I'll scream it again here today. Test the people early. I remember, you know, going to some certain big factories and they test 5,000 people, but never ran these tests on them. They checked the HbA1c. And I saw a lot of people at significant weight. I knew they were pre-diabetic, and I've been screaming for them to change this. This got to change, and it'll happen in this town because I'm bothering everybody about it. So with the complication of diabetes, they're huge. They're huge. You start at the top. Pseudotumors, swollen brain, dementia. Yes, they even speak about type 3 diabetes. What's that? Dementia, Alzheimer's disease. Oh, he's got Alzheimer's disease. Well, he's a type 2 diabetic. Well, what did it? The sugars did it. The sugars hooked up with proteins called AGEs, advanced glycation end products, AGEs. They deposit in the brain, and the nerves can conduct because these agents are throughout the brain. Yes, yes. So it'll do that. The diabetes will blind you, increase rates of glaucoma, retinopathy, retinal hemorrhages. Many of the patients end up with injections in the eyes. I know somebody's had 100 injections in his eye to try to avoid blindness. I have relatives where the whole side is type 2 diabetic. They all think it's in their genes. It's in their genes, all right, because their genes are like this. They don't want to change. I gave them the books, but especially this one brother-in-law of mine. He just will not change the way he eats. I know, I eat with him. He just blind to it. Although I've given him books, I've measured his belly, done everything, and I know he thinks I'm a total pain in the gluteus, and he will not change. It's not in his genes. It's because he will not eat the right food, and I'm trying to motivate you. No judgment zone, okay? And what is heart disease, strokes, vascular disease? Remember we spoke about that? Insulin, raised insulin levels. Insulin itself will not just put sugar into the cell. It does other things. It causes inflammation of 300,000 capillaries throughout our body, our major vessels in our heart, carotid arteries. It inflames them, and cholesterol and fatty substances get deposited, and you develop atherosclerosis. And that's what plugs the arteries up. Insulin helps do that. Yeah. Insulin inflames your joints. So you notice how many type 2 diabetics have had joint replacements? It's the insulin inflamed their cartilage in the joint. It's not just the weight pressing down. It's inflammation. It increased rates of cancer. And there's a wonderful book here, Disease Proof. I encourage you to read it, by Dr. Katz, who I met at the National Wellness Conference. He was the last speaker there. It's just proof of what I'm speaking about. I knew this before that, but I went 35 years, the biggest public health official in the nation. And what's he saying on the cover? Skills you need to slash: heart disease, cancer, diabetes, more than 80%. 80%. We'd be emptying our hospitals if people would get to a normal body mass index. Take a walk every day. No big, huge exercise things necessarily. Just something. Dance, okay? And yeah, 80% of the illnesses you get in the future can be totally avoided by eating right and exercise right. Yes. I mean, it's a wonderful book. I encourage you to read it. So insulin does many things and many other things in your body. In this increase, 75% of uterine cancer. I had it confirmed by the cancer specialist, female at DuPont, and she confirmed it. And I had it confirmed by actually an excellent oncologist, medical oncologist, yesterday sitting in the lounge at Lutheran Hospital. He confirmed it, that obesity has a lot to do with cancer. He confirmed it, and it's probably through epigenetics. You know, I think it's 60, 90% of cancer is due to us having inflamed fat. Remember the nasty chemicals made in fat? They made IGF-1, insulin growth factor 1, is what does this. It affects the cellular walls and causes them to multiply of cancer. Yeah, and there are many other cancer factors, but that's one of the big ones. And insulin, incidentally, is an anabolic hormone. Yeah, you gain weight over it. It causes leptin resistance, okay? The leptin doesn't respond and turn your appetite off anymore. Affects your brain. The appetite center gets turned off. There's a Wizard of Oz living in your hypothalamus that regulates the metabolism of your body, okay? Up there's an orchestra conducting the symphony, the instruments, all the hormones throughout your body. And it will improperly interpret whether you're hungry or not. And so we spoke about type 3 diabetes, but there's great news. What's really great news here? This can be avoided. We can stop it, prevent it, and reverse it in a matter of months, weeks in some cases. I know Dr. Karras at Lutherans, he said, Rudy, I think it's in a week. When you think of gastric bypass, which is an operation that's needed now and then, we have a surgeon at Lutherans, Dr. Sloan was just great at it, really great at it. And that type 2 diabetes goes away in the 2 weeks. And the reason being they're frankly put on a starvation diet. You know, what's called a sleep procedure, but they're stapling off part of the stomach, and you're taking in 500 to 700 calories then, and your type 2 diabetes gone in 2 weeks. But what about thereafter? This is not fully informing you decide to have it done. 1% of the people have bypass, and I fully go along with it. Some people cannot change. And I'll tell you, we have a great guy over there doing it. So some people, it needs to be done. But again, it proves what causes type 2 diabetes. So what's this really all about? Remember we spoke about epigenetics, how what I recommend is high-dense nutrient food, about 80%, okay? Half your plate, half of Rudy's plate is vegetables, okay? And it's the genetic structure of those vegetables, the carrots, the onions, the mushrooms, it has in it biomathematics. Yeah, you won't believe this. This is wonderful news. There's biomathematics in it, and I can't show you on the TV here today, but I have 3 people who I showed in my lecture on Monday that they would wonder about how they were looking, but they followed this way, lost. You don't need to lose 100 pounds, but they did, okay? They look like movie stars, all 3 of them. Not believable. It's because the genetic structure of the body has been made symmetrical because of the genetic information in your food. The reason Americans are gaining a lot of weight, their BMIs are off because the genetic information of the lousy food that they're eating is not compatible with the genetic information of their body, and that body is revolting. That's what's happened. So epigenetics is wonderful news. So 90% of the people who have a problem with their BMI of type 2 diabetes can be cured, can turn it around. I look at it as a cure. Some people look at it differently. It can go away 90% of the time within a few months. Dr. Franklin House thought it's a month. Dr. Karras thinks it's almost 2 weeks. Some people think it's 6 months. But this cellular information occurring can be changed. It's not that hard. And did I say diet? No. Eat differently. That's all. Come to our lectures. Look at my website, cashmanhealth.com. Resources, 70 TV shows. You can watch it. Read these books, which I'll hold up from time to time. And I held up Katz's book. Another one I like is Dr. Joe Furman, End of Diabetes. My friend, he's pretty famous. You see him on PBS. He lives in New Jersey. Last time we played tennis, I beat him. It's true. And on the back of his book is my name. I reviewed it for Harper's, and he threw my name on there. And not to advertise my name, just to let you know some credibility here. Where you coming from, Doc? Okay, a lot of information is where I'm coming from. And nutrient dense, he calls it a nutritarian diet. I call it flexitarian diet. Not a diet, flexitarian way of eating, nutritarian way of eating, nutrient dense foods. And you'll need to gather some more information on that. And the food tastes good. And the nutrients in this food, the 12 vitamins, the 14 minerals, 25,000 phytochemicals, they have no calories in them. They're the enzymes. They run the metabolism of your body, okay? They run the metabolism of your body and a very healthy. And so we would say health equals nutrients of your food divided by your calories, okay? That's from Dr. Furman's work. No diet. Eat all you want of nutrient-dense food. You need a little education about fats. I mean, there are bad fats. The way if you eat a steak today, a lot of times raised on a non-organic farm, they put the beef in a cage for less than 150 days. They don't remove the excrements. They use pesticides and herbicides, and they have a trough of fat going by to fatten them because they make more money that way, and then you eat it. Those are omega-6 fats are very bad fats. You don't want them, but that's not the majority cause of problems. It's the sugar. It's the main problem. So learn to watch the sugar. You need to learn the 50 different names for sugar. They're posted on my website now. So you can, agave and maltose and dextrose. You need those names because when you're reading the labels, matter of fact, if it's got a label, probably ought not to eat it. But if you're eating some of those things, read the labels so you understand what sugar is. Fats, you need some fats. You need some essential fats to take into the body because they are the intel chips of your body. There's some fat in every cell of your body. There's not a cell in the world, in nature, that doesn't have some fat in it, okay? But it's got ALA in it, okay? Linoleic acid, non-linoleic acid, and alpha-linoleic acid, very healthy fat. You need it. That's what helps picks up the energy from the sun, okay? That'll help for energy from the sun. So we need some fat. But those omega-3 fats, that's why we want to take a little fish oil, EPA, AL, a little supplement, 1,000, 2,000 milligrams a day extra. I take that one. I don't take many supplements, but I think that's a good one. If you're not eating a lot of fish or sardines or something, maybe get your omega-3 that way. That's the essential fatty acid that jump from cell to cell. Before we had heart and lungs, living things lived on essential fatty acids. Yeah. The trouble is we Americans are eating 20 to 1 omega-6, the bad fat, over omega-3, the good fat, 20 to 1. We should be 1 to 1, okay? So you got to watch the fat, but fat will not raise your blood sugar, even bad fat. Sugar raises the blood sugar, the insulin level, okay? The insulin level. That's very interesting, isn't it? So if you eat fat from nature, guacamole, stuff like that, okay? If you eat fat from nature, it's very healthy. They don't want to raise the blood sugar. Things that are man-made with fat in them, like the non-organic beef or pigs or chickens that they're raising and feeding nothing but fat to fatten them up. Milk is 50% fat, okay? You can buy a lower percentage, but it's still, 2% milk isn't 2% fat, okay? It's 35% fat. Just remember that. You want to get a big belly, drink 10 glasses of milk a day, like a guy told me the other day he couldn't get rid of his pot belly. Well, what do you eat? Well, I drink tea. I drank a lot of milk. I drink about 2 quarts of milk a day. I said, well, that'll do it. So nutrient-dense foods we're talking about. Now we have, macronutrients, which are the proteins, the fat and the protein, about 20% protein diet. Pear wrote a book, that there wasn't not enough protein in plants. Well, she was wrong, but then she wrote another book. She wrote that in 72, I think. Wrote another book 15 years later, but no one ever heard of it. So people still think that you need to eat animal products to get the protein for your muscles. Wrong, just dead wrong. You can get all the protein you want from plants. The only supplement you might need to take is some B12, but people are wondering that's not even necessary because it's stored for 3 years. Fat, 20-30%. Dr. Furman even said it. Yeah, used to be saying 20% fat diet. Now, who knows what the percentage is? But fat is not your enemy. Sugar is your enemy. That's your enemy. If you're way overweight, if you're eating a lot of real fatty foods, well, you're going to gain more weight because it's 9 calories per gram. But and sugar will be 4, alcohol 7. Okay, protein 4. So you want to watch fat a little bit, but that's not the cause of the majority of it. Okay, what percentage? Carbohydrates, complex, 50%. No, who knows the exact percentages? And you got to eat whole carbohydrates with the coverings on it yet, okay? But if you're diabetic and you're eating baked potatoes, well, your blood sugar is going to shoot up. The best thing a diabetic can do, the diabetic's friend really is the glucometer, that you check your blood sugar. And I have a friend who's pre-diabetic who I'm curing pretty quickly here. And he tests foods for me, okay. I haven't checked the blood sugar before. He eats the thing. At 30 minutes and 60 minutes, checks the blood sugar again. There should be no rise. There's no rise, your body tolerates that food. A good thing to remember. And remember, when you're going to start this way, frequent blood testing, frequent, because your sugars can drop, okay? But as you get rid of this problem, of course, you don't need to do it anymore. I have a friend who spends $4,000 a month on this insulin. If you ate it the right way, you wouldn't need it. $4,000, yeah. Many people spend even more. Look at the money you could save. And you say, well, good food is too expensive. Well, I say to you, if you lose significant weight from I had one patient cut their body weight in half, honestly, and what happened to the food bill? Way down. So if you lose some weight, it's cheaper, of course, you buy less, okay? And actually, Dr. Katz studied it. It's right in his book. If you really study it and you're careful what you buy, the cost, it's a wash. good food and bad food equal cost. You always hear, oh, good food is more expensive. Baloney, baloney. You just got to learn how to shop for it in season and freeze it and learn a few tricks, and it's really not true. And the standard American diet is fat, salt, and sugar. Remember I said Rudy's plate, which I throw in here, half vegetables, and then some lean protein as a quarter of the next part of the plate. You know, some chicken, some turkey without the skin on it, and with vegetables, and fine, okay? I didn't say be vegetarian, never said that, okay? Eat some but nuts. Dr. Furman will eat an ounce of nuts a day. I do too. That's a snack I keep in my car. I get hungry, like I came here for the show. I know I get a little hungry during the show. I ate about 4 or 5 macadamia nuts. It's got fat in it, but I don't care. It doesn't raise my blood sugar. I'm 139 pounds. Do I care about those macadamia nuts? I may even have some more before I go home. Before I go home here, before I play tennis tonight. Okay, so keep some. That's a good snack. Learn about some snacks. Egg whites is a good protein. You want to put some protein in every meal because it doesn't raise your blood sugar. You know, some egg whites would be good. Yogurt, Greek yogurt, no fruit in it. Greek yogurt, it can be 4% sugar. It's okay. Try to avoid more than that, and have the real and have it be a live culture. Okay, that's much healthier than milk. Live bacterial cultures in it. That's yogurt. Very healthy, a good snack. Before I go to bed, I might have a little thing of yogurt, maybe 100 calories at most, satisfies my appetite, sleep good, puts probiotics into my gut, you know, it keeps my gut bacteria handy. So that's kind of interesting. And let's go through Doctor's Way of Eating. Actually, I got this out of an excellent book I like to recommend. He's got a TV show, and I read the book twice now, Travis Stork. Good book. Good book. It's not just about diabetes, just about proper eating. I think he's got it. I've read the book a couple of times. I recommend it, the book. There's nothing, you know, I agree with 95% of what he's got in there. And a good book to read. And so what does he recommend? The 10 top things. Eat with your mind. Look at your food. Look at it. A lot of us eat mindlessly. I do. A neurosurgeon all these years come home and you think I look at the food? Give me a break. I was starved. And but look at it. What are you eating? You get to gain knowledge. I'm here today to give you knowledge. Look at your food and put some protein to work for you because it doesn't increase the sugar level. Put some in every meal. Learn about some good proteins, and the tables in this book and my websites tell you what some the good proteins are. But remember, nuts got protein. There's more protein in 100 calories of broccoli than 100 calories of beef. Yeah, I prove it to you. Twice as much, actually. Okay, you have to eat more broccoli, obviously, but it's 100 calories of broccoli. It has more protein than 100 calories of beef. Very interesting. And complex carbohydrates, starch, like a carrot, like beets. Again, you get to check, remember, the glucometer. You check it, what does a beet do to your blood sugar if you're diabetic? If you're non-diabetic, that's not a problem. And see what it does to you, for example. So, and eat fat from nature. Remember what I said? Fat from nature is very healthy. You don't have to worry about it. And guacamole as an example. Vegetables and beans have some fat in them, okay? Nuts have some fat in them. They're fine. Good for you. They're not this fully saturated fats, for example. 2 or 3 pieces of fruit, okay? Unlimited berries. But remember, not 10 pieces of fruit because of fructose. I told you why. Legumes, beans, peas, lentils, hummus. Hummus is a great snack. In the evening, you have some hummus because it's made from chickpeas, sesame seeds, garlic, olive oil. You can make it different ways. Very healthy. Use that as a dip. Put some fresh vegetables in there. Great snack. I know the restaurants that make it. I prefer these restaurants where I have it sometimes as a main meal. Yeah, last night I was at Club Soda. I had that, and then I had a beet salad, and that's any better than that. And Cata Blue, same darn thing. They have these choices available now. That's very important. Nuts, ounce of nuts a day. And remember, Dr. ferment even eats two ounces, I wouldn't recommend that. But make sure you're not allergic to it. You don't have kidney stones because it oxalates in nuts can cause a kidney stone. But so, and Greek yogurt, make that your favorite protein. Look at the different yogurts, but don't have ones with fruit, a lot of sugar in them. So that's the doctor's way of eating. I recommend this book, Travis Stork. And again, let's go through pre-diabetes again. This is the biggest. We could save $1 trillion if we diagnose everybody in this country with pre-diabetes. We could save $1 trillion. I don't know why it's not done, but I'm telling you, I'm pushing it. And the time I get done, every provider I know will properly check people for pre-diabetes. But you insist on it, okay? Just insist on it. You want to know if you got metabolic syndrome, you know, check the HDL, have them measure your belly, your body mass index, your LDL, and the cholesterol can still be part of it if you have high blood pressure or not. Triglycerides is the big one because when the fructose in the liver makes fat, and fatty liver will increase the triglyceride in the blood system, and that's part of the metabolic syndrome. Is the triglycerides. Very important test. Remember I said about the ratio, triglycerides versus HDL ratio for prediabetes. I think very important. Elevated blood pressure, that's part of prediabetes. Waist size, okay, great, very important. Triglycerides should be less than 150. And very low density LDL, less than 500 particles, okay. HbA1c, 5.7 to 6.4 is pre-diabetic. But, you know, 6.5 you're diabetic, 6.4 you're not diabetic. Give me a break. The complications that we spoke about earlier throughout the body, from cancer to skin stuff to heart attacks to strokes to blindness. Dialysis, I didn't mention previously. The most common cause of loss of your kidneys is type 2 diabetes. Once they start dialyzing you, your life expectancy's got a number on it, okay? Once they start amputating your toes, there are about 600,000 amputations a year in this country. Once they start amputating your toes, your life expectancy's got a number on it too. So, and it starts with numbness in the arms and legs. They amputate arms too. I've seen it, and legs. Matter of fact, I went to a restaurant recently. It's named after a state in town recently for a birthday thing, and I normally wouldn't go there, but I went there to honor my wife's sister. Went there. When I left and drove down the highway, I cried. When I was at the door, there were 2 type 2 diabetics there with amputations. Yeah, they had the right size, and they were, you know, 45, 50-year-old. Both of them were women. Yeah, and there was one room I went into. There were 15 people there celebrating, having a wonderful time because of all the sugar they're eating. Just laughing and screaming, and the average weight probably 250, 280. Okay, and I was driving home, because I see it. You see, I'm an expert on that. I cried, and it wasn't. I'm not that sentimental person. Tears ran down because I understood, and so we want to, if they get that HbA1c, you know, try to get it under 5 by proper eating. It'll be quick too. I know somebody was 11 who was down to 6 a matter of a month. Yeah, it's quick. Don't think, and you'll read in the books, well, they can only drop it down 1 point. Yeah, medication, you can drop it 1 point, but you eat right, it'll just dive. So please, success and failure, here's the big one. Do I eat perfectly? No way. I eat seafood. If I see it, I eat it, okay? Don't eat anything with a mother in the face, okay? We got to have a laugh here. Success and failure. Failure is having no plan. Believe me. So if something goes wrong, all of a sudden you grab this ice cream and eat it. That's not failure. Just had a bad day. Next day, boom, you do it right. That's just the way life is. Believe me, even at 139 pounds, 140 pounds myself, I have days where I eat crap and I feel guilty about it because I'm stressed or who knows the reason, or because I eat seafood, okay? But I keep it out of my house, but you go visiting somewhere or you're at a restaurant and the tray shows up, it's got 6 desserts, and I've had a very stressful day. I mean, I have a heck of a time. So by the next day, I'm not going to beat myself up. That's not a failure, okay? That's just life. And but a lot of people today in this country, is part of the reason it'd be hard to change you, they're deluded about it. They have a delusion. They don't and lack of information. That's why I'm here. Some are in denial. Many are in denial. Some are disabled because of it, and that's how they collect their check, and they don't want to change. That can be it. Certain racial groups, incidentally, ethnic groups, are much more prone to it because their genetic structure based through evolution. But it's not the genes that's doing it. It's the food they're eating, the biomathematics. The genetic information is a reaction to the gene structure. That's not the cause. That's not the cause. The cause is the genetic information in the food, the wrong food in there. Yeah, and there may be sometimes groups. I go to certain churches I go to because I teach this in churches through the Daniel plan. If any of you have a church would like me to come in for free, I'll stand right on the pulpit and give a 20-minute talk on wellness, which is taught through a Daniel plan from a religious standpoint, through faith, food, focus, fitness, and friends, those 5 F's, is a very effective way. I've done it in churches many times, but I see certain churches where 90% of the people clearly seriously overweight. I don't blame them, but I think they're living a delusion, a denial, and sugar, incidentally, is addictive. It's addictive. And I've debated people on TV about it, and recently I read that sugar is 5 times more addictive than cocaine. Wow. So we use it to feel good. Its reactions to the brain. It's true. That if you look at the chemistry of it, there's only 1 molecule difference between cocaine and sugar. Yeah, look it up. It's scary. It's scary. So it's very addictive. It is for me. I want to feel better. It's, you know, 3-4 operations years ago, and I go in the lounge and there's bad things in there, and I eat it. That's been changed, though, I will admit. If the guy's there looking for the guy responsible for changing the food in the lounge, I got sweet on the dietitian. She did it. She did it. And there's still opportunity to mess up, like bacon in the morning, you know, very salty and fatty. And I've seen some of the people that shouldn't be doing it with plates like that, eating the whole thing for breakfast, when I'm not there. I'm not the food police. I'm trying to save them. And it's not easy. It's not easy because very stressful jobs, like, you know, but if you don't do it, it's going to result in 20 years coming off your life, or living in a nursing home, living in a dementia unit, like a friend of mine, a lawyer I know. His wife came up to me at the symphony the other day, and type 2 diabetic, and he's living in this little unit on another side of town. Oh, it looks like a hotel, but I don't want to live in that hotel, and I don't want you to live in that hotel, because he doesn't recognize his wife, and a terrible thing. So an action plan here, okay? Look at the food. I use the acronym ABDOMEN. No sugary drinks. That's 50% of elevated BMI. No white bread. That's pure sugar. Look at the glycemic index, where they check food and see how quickly your blood sugar goes up. It's 0 to 100, and maybe, you know, eat 50 or under most of the time. If you just eat a little bit of it, like carrots, for Pete's sake, I don't know why they're high in the glycemic index, but you don't eat much of it. And as a matter of fact, if you look at glycemic load, meaning the amount you might eat, it's a 20. That's nothing, okay? So, but white bread would be 100. A bean might be 20. So look at the glycemic index of your food. I think that's good. No white bread. Remember, bread puts down the wheat belly. And matter of fact, if you just cut out bread and ate only Ezekiel bread, that's bread made from sprouts. That's 30% less calories, full of vitamins and stuff because it's sprouted. Very healthy. You can get it in the freezer section of your store. They all got it. And very much more healthy if you need bread. But if you want to get rid of potbelly quick, eat no bread. Avoid the breads and say ice cream. Your belly will fall off you pretty quick. Yeah. And as a matter of fact, I thought I always was a normal weight. So when I cut out some of the nasty breads and ate only Ezekiel bread, all of a sudden I had to go to Despis to get my pants pulled in for a whole year. Yeah. You know, I like clothes. So every week, 2 or 3 pants off to Despis to bring my waist size, you know, 31 now. Proud of it. And I work out an hour every day at one of these places that has a very low price. I mean, I belong to a lot of places, but I honor this place because they dropped the heck out of the price, and I see very ordinary people working out there. I love it. I compliment that place where they drop it $10 a month. Give me a break. I love it. And So that's important if you have time. I got time now. No salad oils. You know, a tablespoonful of olive oil is okay in a salad, but use vinegar maybe. Maybe use nothing. But if you eat white bread and you put a lot of salad oil in there and you get a piece of pie for dessert, that's about 800 to 1,000 calories. That's all you did. Cut that out. So eating out is a bit dangerous because those things are available, okay? No sugary or fatty desserts. No alcohol. Alcohol is full of sugar. I mean, 2 or 3 glasses of wine a week, okay. I mean, some books will say, oh, men can drink 2 glasses a day. Baloney, it's full of sugar. And before you know it, you're drinking 3. You know what I mean? I'm not an anti-alcohol person, but I'm telling you the complications I've seen from cirrhosis and liver transplants and liver cancer. Matter of fact, my wife went to a funeral yesterday in Syracuse of a very loved individual that had liver cancer, and I didn't want to ask what it's due to, but you know, it's you worry about these things, and so it's very important. What about exercise? What about exercise? And I could talk for 2 days on exercise. Okay, walk 30 minutes a day. Do some light weights. Do some light weights. I think that is important. And the exercise you enjoy the most is the one you're going to do. I say take up dancing and music. No, I'm too sick to exercise, so I dance in place. No excuses. If you can't walk 30 minutes, then walk 10 minutes 3 times a day if you can, okay? So that reduces insulin resistance. In summary, you got to pick a path. You got to watch what's on your fingers, on your forks, and how you use your feet. Okay, no shortcuts. Eat a nutrient-dense diet. You can eat some animal products, but make them friendly. Find out what's a lot of fish today is made in ponds. They're fed soybeans and genetically modified food and everything, and corn, which has been changed, and it's unhealthy. Ask the waiter, where is the fish from? Is it from Alaska or the ocean, or is it out of a pond? You don't want to eat it out of a pond. Most fish today is out of a pond. I could tell you all the restaurants in town. You'd be surprised. Some of the fancy restaurants in town here, the food's not very good. But they serve you for bread, begin, sugar. Not much sugar. If it's white, it's sugar. I ask them, make half black bread or something if you need to eat bread, okay? And ask them, where's this beef from? Where's this fish from? Use your freezer. Learn how to cook. Learn how to make soups. Make them last for 3 days. Become a cook. Only 1/3 of people know how to cook, and maybe half of those aren't cooking too good. Mark Hyman, Blood Sugar Solutions. His family does not start the evening meal till he is home. Being a neurosurgeon, my family probably would have starved, but him being an internist, isn't that wonderful? They never started the meal, the cooking of it, till he was there. So he was part of it. That's a family thing. That's a healthy thing. Eat beans and greens and mushrooms and berries and seeds. So look at CashmanHealth.com for this PowerPoint, okay? You get 70 TV shows on there you can watch. And once a month, I'm giving a lecture on stopping and preventing type 2 diabetes at Lutheran Hospital. Come to that. We had 206 people this past Monday. Join us there, and we'll get rid of this plague and this monkey off your back. I love you. Why am I doing this? Because I love you, care about you. Namaste. Hope to see you next time. Join me on a walk or on a cup of coffee, or send me a book. I'll read it and meet you and discuss it with you. I learn something from everyone.